good, the bad, and ugly of Lyme disease. This is part of a Common Sense Lyme series. I'm Dr. Daniel Cameron. Why this matters. Lyme disease is growing in numbers, growing in complexities. There's co-infections, and it's important that we do early treatment. But even early treatment is complicated because at least 1 out of 3 patients on follow-up have problems, maybe because of co-infections, and patients need to know the full picture. The good is that if you catch early, there's often a good recovery. Now, often still means that 1 out of 3 patients on follow-up have been shown to have chronic illness, chronic complications. Erythema migrans rash is an important marker, but you can have a co-infection that doesn't show up at the time. And also there's failures even in people who seem to be relatively simple. Early antibiotics like doxycycline work, but some people fail. There's also other oral antibiotics like amoxicillin and azithromycin, Ceftin, that are quite helpful. But there's no lasting symptoms in many cases, but still, 1 out of 3 is still a problem. The bad is that lingering symptoms after treatment include fatigue, brain fog, joint pain. There's autonomic issues, neuropsychiatric issues. Some people have a cardiac problem called POTS, with dizziness with posture, or PANS with acute neuropsychiatric issues. There's also some people that use the term post-treatment Lyme disease syndrome. That is that they've had a month of antibiotics at least, they're still sick, they call it a syndrome. This is often used by doctors who focus on the immune issues that related to Lyme and not on the potential for co-infections. I would prefer that they look at a persistent infection or co-infection before calling it a syndrome. The ugly is that chronic Lyme disease still occurs. I see patients in my practice who've been sick for years who do well with antibiotics or treatment for co-infections, and I have people who do poorly. Bartonella and Babesia are examples of infections that are being studied. I find Babesia is particularly a problem because it's not treated with doxycycline or amoxicillin. The ugly part is that there's neurologic, neuropsychiatric, psychiatric, cardiac symptoms, autonomic issues that can be found months to years later. Misdiagnosis still occurs. Patients are being told that they have another diagnosis, or they don't know what it is. They just know it's not Lyme disease, or people are told that they have to have a positive blood test, or they've even been told that there's no possibility of infection after 3 weeks of doxycycline. There's also stigma attached to Lyme and co-infections, and it certainly has a long-term effect. So what patients need to know is that they should be informed that early aggressive treatment is helpful, that if you don't see the tick or don't see the rash, you can still have Lyme disease. It's better to get treated early rather than later. You should trust your symptoms. If Lyme disease is a consideration and you don't have a tick and rash, it still should be part of the evaluation. If the tests are negative, it still should be as a thought. Co-infections matter and chronic illness is real. So thank you for joining me for this Common Sense Lyme series. Have a good day.